Hey moms, it's Laura Ollinger. Welcome to the Positively Healthy Mom podcast. Because there's no manual for the hardest job in the world. Hello everyone, welcome to today's episode of the Positively Healthy Mom. Today I have Lidia Molinara, who is a pharmacist and a patient safety officer, along with lots of other things. She's a speaker, a podcast host herself. She has spoken at the UN. She's given her own TED Talk called 3 Steps for Medication Safety. She's very passionate about empowering women. And so that's the topic she brought about at the United Nations. I'm just fascinated, Lydia. So tell us a little bit why you're so passionate about what you do.
It's just been a long career, and I've seen so many things in my career that I wish I could reach out to the world and tell them, do these things, and that will prevent you from coming and explaining what happened to you after the fact. Because so many things in healthcare are preventable, but it's, again, that education piece. You know, we talk about knowledge is power, and it really is when it comes to healthcare. And that's really what I'm so passionate about, is spreading the message that we need to be advocates and really active participants in healthcare to prevent harm that can cause a lot of problems for us.
And so in the context of moms with teenagers or tweens, I want to lay out some concepts here. So first, we've got the idea of, our teenagers can be prescribed medications. And so you talk about, what are the types of questions we should be asking our prescriber? And so common things that teenagers are facing: anxiety and depression, ADHD, for girls, whether or not to be on birth control. And then for tweens is when they start the HPV vaccinations. So, where do we start? I'll just kind of let you guide and direct and help us figure out, what do we need to know about these things?
Well, the first thing I would say is there's always this golden rule when it comes to medications. It's really, really important to understand that when you go to a prescriber, the first thing you need to do is make sure that you have signs and symptoms recorded with severity and dates. I'm always saying this because if we're having a conversation and I say to you, well, I noticed that Tom, my son, is really experiencing some symptoms and he doesn't feel well. He just thinks that, he's, having pain here, or he has this headache, or he can't focus. And I, as the prescriber, I'm going to say, oh, how long's that been going on for? Have you noticed anything else? Has he this? Has he this? And I'm going to ask you about another 20 questions. So if you can keep track and the conversation goes like this: my son Tom has had 3 headaches in the past 4 days. He rates them from 1 to 10, 8. All of a sudden now it's a clearer picture. And so as a prescriber, I can then direct much quicker to what I feel we need to do as far as tests, or what we need to actually ask more of, or what you need to monitor more of. So obviously having the piece, like I say, the communication piece of recording and tracking symptoms, it's really important. The second thing is in the teenage years, we usually have our children in groups with other kids, and there's this thing called experimenting with different things that are available out there. And so being honest and saying, you know what, and this is hard to do with teenagers. I know they're not going to come and tell their mom that maybe they did smoke marijuana or they did try a drink or things like that. But having that open communication with your children is really important, even when it comes to prescription medications. Because if you can be clear and say to your doctor, Tom is on an antidepressant, but he went and smoked marijuana, or I think he's doing that more. How is that going to interact with his antidepressant? Those things are really important to know as well. So when I say tracking, I mean sort of the whole thing. So when you go to a prescriber and you have that information, that's step 1. Step 2 is going to be for really looking at those symptoms. There's a lot of really good resources online, trying to get some information before you even go to the doctor and saying, oh, he's experiencing these things. Do I need to make an appointment? Do I have to bring these up? Is this just a passing discomfort? How severe is this? Anytime somebody complains about it, I would say more than twice per week, go see your doctor, because something's going on. It's not just a passing thing. I mean, if you ate something and you have a stomach ache, it's going to pass in 48 hours. Even if you have the stomach virus, it's going to pass in 48 hours. But if it doesn't, you need to make an appointment and you need to start tracking. That's really
Mhm.
what I always suggest is the most important thing. And then when you're at the prescriber, the golden rule: what is the risk versus the benefit of this treatment plan? So, if the risk in your mind or when you're asking the questions is higher, then I wouldn't go with that treatment plan because the benefit doesn't outweigh the risk. So, that's ultimately the number one thing you need to determine. So, how do you do that? You have to ask the questions. Why is this treatment plan going to be the best? How will it affect him? What are the long term effects of this treatment plan? What are the long term effects of this medication? What kinds of side effects are this medication going to cause? What do we need to watch for? How does it interact with food, with other medications, with vitamins and supplements, with his activities? There's some medications that can cause issues with muscles. So if he's in a really like a gymnastic sport or hockey, like what happens if he starts to take this medication with that kind of physical activity? So you really, I can't emphasize enough that asking a lot of questions to give you that information is going to help you make the best decision. And
Mhm.
my favorite sentence is, if this was your son, what would you do? If this was your daughter, what would you do? Because it personalizes that relationship much further, and it will cause a pause. I've often used it, and usually the physician, the specialist kind of does a bit of a pause and has to think like, in this situation, what would I really do? And sometimes you get to a more personalized, truthful answer. And even at that, when you go home and you take that treatment plan, you have to monitor it. So it might work great for the first 2 or 3 months, but then something changes, something falls off. Teenage brains are continuously evolving.
Mhm.
They're growing. It doesn't stay static. So medications, when I often say it's like, you're mixing a punch and you're putting different things in, the color changes because after time, those chemicals will change. Well, the brain is full of chemicals. So if you're adding a chemical, you got to watch the side effects. And you should know which side effects make it so that I need to stop this or I have to go back and seek more medical attention. And at
Mhm.
what route? If this medication is causing him to have trouble breathing, I should go to emerge, right? So that one's an obvious one. But if this medication is causing a lot of, you know, um, drowsiness in the morning, can't get out of bed. Is this a symptom of just being a teenager in the sense, or is it a symptom of the medication? And that's where it gets tricky. So that's where
Mhm.
tracking and questions is going to be the prevention that we need.
Okay, that's fantastic information. And I already feel actually more empowered because I'm a mom, just like we all are, that's busy, right? And so when I take my kids to the doctor and I've got 4 kids, half the time I don't know, I don't remember. I'm like, this happened, and I don't have that detailed information because like life just feels too chaotic. But that already made me feel like, oh, I need to be better about like really tracking, taking notes, asking good questions, asking all these things. And so the next question I wanted to ask you was something you and I chatted about earlier, which is oftentimes we as women are afraid to challenge if we have a male doctor or a male pediatrician for our kids. And we're afraid to kind of like push back and challenge them. And so, what do you say to moms who just assume that the doctor knows everything and they're God and they know the right answer? Like, how do we realize they're actually just humans? They might not have the full picture. Maybe they're in a rush. Like, what do we do to get our minds straight so that we can have an educated conversation that feels empowered and equal?
Look, I've been there. I as a pharmacist, when I go see the doctor, feel the same way sometimes because I'm like, it's on the tip of my tongue. I got to say this. Now, how do I say it so that I don't feel like I'm offending, the physician, or that I'm going to be overstepping my boundaries? And oftentimes I won't even tell them that I'm a pharmacist because I don't want to, have that happen. What I often say is, and what I do is I have my questions written down before I go in. So when I sit in the chair, the first thing I'm going to say is, I'm here because I have some questions and I need to speak to you about my son. And so here are the questions that I have. And I just start with that. I don't even like let the conversation, get away from me, because sometimes you start talking and then the question that you went there to ask, you forgot.
Right.
That's happened to me too. So my way of handling this is writing it down and making it easy for me, because as moms, you're right. Like, there's going to be 15 different things, maybe from 4 kids that come up, and it's like, I don't know, where am I supposed to write this all down? I
Yeah.
just take my phone and I do a voice note, or I just put it in my notes, or I just do a reminder, and then I go back and collect it before the doctor's appointment, and I kind of write it all down. So then I say, okay, Tom said that he had these 5 things, these are the questions I need to ask. And then when the physician is talking to us and you feel like, yeah, no, I don't really like that, I don't really want to do that, then what I'll often say is, I just have to clarify this because I kind of hear what you're saying, but I don't understand.
Mm.
You clarify and you say, because when I explained that he's really not waking up in the morning, what I meant is he's I can't arouse him. I can't actually get him out of bed. It's very difficult for him when he's sitting at the table. He looks like he's going to fall asleep. Or because he's been put on this medication, he's not the same engaging child that I remember. He's he kind of looks like a zombie when he's walking around. The teacher said this, like, I'm really concerned. What should I be doing? That's how I put it back. I often will just ask the question again by saying, I don't know if I'm explaining myself correctly. And
Mm.
sometimes it's that, like talking to anyone, when somebody is sort of like, no, closed off, this is what it is, this is how it's going to be. You want to try and interject. Don't feel that because the physician has all the knowledge that they are the God. They are your guide. They are the ones with all the knowledge. And trust me, they have a lot of knowledge. This isn't about, that the healthcare professionals don't know. They know, but they don't know you. They don't know your child. They don't live with him. You do. So it's really important to advocate and to express it. And that's the best way that I've done it. I just say, okay, wait, but I know what you're saying, but maybe I haven't explained because I still don't see how what you're saying and what I'm saying help him. How is it going to help him? How
Yeah.
is this going to help? I still have this concern. How does this treatment plan help this concern? And sometimes it will be, and sometimes it will be. Let's try it and see what happens in a week. Come back and book for a week. And when you get told that, make sure when you go to the front desk to book for that week that you say, the doctor told me I had to come back in a week and I want to be back in a week. Not, oh, the next appointment's here in 3 months.
Yeah.
Nope. You say, oh, well, then can I speak to the physician again? Because he specifically told me I had to be monitored in a week.
Yeah.
Like, that's really important because sometimes at the reception desk, we don't get where we need to go. And so, advocating, I often say, we're sometimes taught authority means we need to lower our voice, but in healthcare, authority just means knowledge. It doesn't mean that we need to be silenced.
That's really great. And I know where I live, and I'm in Texas, and like a lot of the Southern women, we're so polite, and we want to be friendly, and we want people to like us. And so we're just like, okay, that's fine. I'll see you in 3 months, even though he said a week. That's the type of thing that we would do. Not everybody, but it's kind of a
Oh,
generalization.
sure.
But
Yes.
that's something that would be typical that I can see happening. So let's go through the medications, because I know super common is the anxiety and depression medication and the ADHD medicine. I don't know if we should lump those all together, even though they're separate. Because what happens is, doctors will prescribe those. And I do have, lots of my clients are on those medications. And so what'll happen is I'll find out, my client's on this medication, and, they say, oh, give it 4 to 6 weeks, see how it's working, come back. And so sometimes I'm with a client and they're, from one medication to the next one to the next one. And so I'm trying to help coach them from, the mindset and the skill set side of it and the confidence side of it, because that's what happens. A lot of times these things cut down kids' confidence. And so as a pharmacist, what can you do to educate the moms about what we need to know about these medications, just in a general sense?
One of the biggest things, and I am going to preface this because I've seen it as well, and I educate this as the first thing that I say. When someone is newly put on, or when someone is on, and it does take 4 to 6 weeks. And the reason for that is because, like I was talking to you about sort of the chemicals and the balance of the chemicals, it takes a bit to change, especially if it's an SSRI. So the serotonin selective reuptake inhibitors takes a bit for your body to kind of change. It's kind of like working out. The muscle isn't going to happen tomorrow that it's going to change. takes a bit. So that's kind of the process, that 4 to 6 weeks. But when people are on antidepressant medications, especially teenagers where the brain is evolving, it's really important to have a conversation when you start them on about suicide, ideation, and suicide and thoughts of suicide. Because depression equals sometimes, right? Thoughts of depression. So then there's this blurred portion of, is it the disease or is it the medication? So
Mm.
I often say, anytime a child is put on an antidepressant, you have to talk to them about feeling like they are making a plan for suicide. Because if they are, you need to take your child to the doctor's office or to the emergency department if they're in active pursuit and get them off of the medication. Because we don't realize that one of the worst side effects of antidepressants is suicide ideation.
Mhm.
We didn't know that when these were all coming out. Then we saw a spike and a rise in suicide, and they were on antidepressants. So, what was the correlation? Was it because they were depressed or was it because of the medication? Studies have come out to show that yes, it's because of the medication as well. So, that change in chemicals can sometimes push that suicide ideation. So, it's really important to watch that and to have that conversation. Again, it's risk versus benefit. If there's a non-functional, very withdrawn, you know your child. If they're not themselves, yes, these medications can help. And sometimes it is this trial and error, and it's exhausting. This is working, this isn't working, this side effect isn't great. Medications isn't the be all end all. We get excited when we're like, oh, we finally figured out what's wrong. Now we're going to treat it with this medication and things are going to be beautiful and we're going to sing in the rain. No, that's not what happens typically. It's a trial and error and a process. And you have to be understanding, even to get off of these medications can sometimes take a year, 2 years. It takes time because the brain chemistry changes. And that's, again, the risk versus benefit. But I'm going to tell you that there is benefit in these medications. If your child has tried to commit suicide or is suicidal, do you put them on this medication? The answer to that is you have to speak to your healthcare professional and look at the entire picture. But yes, then the benefit will outweigh the risk, because if that's already happening, it might have a bit of additive, but you're not going to get a chance to find out if they're making a plan for suicide already. You've got to change that brain chemistry now. So it's tricky. It's not a one size fits all. That's why tracking is so important. Having just a little journal, even for your teenager to write and to track and say, today I felt, and then just check marks. I felt from 1 to 10, a 5. I felt a 4. Did I have suicidal thoughts today? No. So sometimes that helps. It's just tracking. It's really important to track. When we look at all the other medications, it's the same thing. Know the side effects, understand the risk versus benefit, and really get to know, is this benefiting your child? If it's not, go back and just say, he's not any better on this. Is there something else? I always start, even though I'm a pharmacist, I always start with non-drug measures first. If you haven't tried non-drug measures, I think you need to go back to the non-drug measures and try that. Again, though, if your child is already past non-drug measures and those aren't going to help because they are in hospital and they have attempted suicide, having a non-drug measure is going to help support it, but it's not the only answer. So there's a spectrum of when you medicate, and that's again risk versus benefit.
Yeah, I'm glad you clarified that, because I think a lot of parents are, either very anti-medication and they want to go the holistic, natural route, and others are just like, "Hey, fix my kid, put him on the medication." And so you don't often find the ones that are patient enough to like try the non-drug measures. And from my angle, that's one of the things I coach on. I have a health coaching background, so we do all the modifiable lifestyle factors: diet, sleep, exercise, stress management, all those things. And then add in the medication if needed type of thing. So, and then same with ADHD medicine. I've heard a lot of clients, in fact, my own child, one of them was on ADHD medicine, and it was frustrating because they're like, try this one. Okay, so for 6 weeks. And then if that doesn't work, we'll try this one. And sometimes it is hard to be patient. It really is, because when your child is suffering, they're not doing well, then you want that fix. And it's really hard to have that patience. Can you give any support or guidance for that type of scenario?
As moms, we don't do this enough, but we need to also take care of ourselves when something like this is happening. Take your 5 minutes, breathe, write down what's happening, try and track the patterns, and really look at, again, is this a welcome thing in our life, or is it a negative thing? What is causing this problem? How can I help support this child so that they feel better? Because ADHD medication will correct some issues with ADHD. Others are modifiable by non-drug measures. And those seem to work almost sometimes the best. So ADHD, sometimes the child won't listen, right? They don't even hear you. It's not that they're trying not to listen. They can't. They don't hear you because they're hyper focused on something else. So getting in front of them, talking right in front of them and saying, listen, I need you to do your shoelaces, or, whatever that is, or I need you to get your backpack. I need you to be ready in 5 minutes. I'm putting the alarm on. And then you give them 10 minutes, but you put the alarm at 5 minutes because it's going to take another 5 minutes. It's really important to have the patience and track, because you're going to start to see, this is like in anything, right? I don't know how else to say this, but it's just like when you start to work out. Oh, I'm going to work out. I'm going to lift heavy weights. I'm going to do so well. And then you're sore. And then you have that symptom. And then you're like, I don't really want to do that again. That was really not fun. And then you start to see, by tracking, you start to see things going better, or you start to see things not changing, or you start to see things not improving. So it's either it's getting better, it's staying the same, or it's getting worse. How are you going to be able to make a difference if you don't know that? And we don't track enough to know. And that's the biggest issue, because if you start to see improvements every day, you start to hang in there, right? You're like, okay, I know it's a struggle, but I started to see improvements. If you're seeing absolutely no improvements, look, we say 4 to 6 weeks for the full effect, but you should start to see some improvement. If you're seeing things degrade and it's actually causing them to have really bad diarrhea, or they don't even want to go outside now, they're afraid to eat and they're losing weight, this is not helping. This is not what the overall goal was. They can't take it with their other medication because that's causing them to have increased anxiety. We talk about ADHD medications. It can increase anxiety.
Yeah.
So they take it before bed. Now they're up all night. In the morning, they're sleeping. So even understanding how to use the medication properly is going to make a difference in the results of the medication. So really understanding how to use the medication and tracking it is also going to equal better results and help you get through that painful process of, let's see if this medication is going to work.
Awesome. That was really helpful. And then last, kind of the two that we touched on, birth control and the HPV. I know they're not the same thing, but I'm putting them into the same category. So what do you do to advise about those two things?
Well, first is teenage girls. We know that they start menstruation, so they start to get their period. Really good to get your daughter to start tracking her period. It's a really good idea, because there are things that can happen with periods. Being on the bus and then getting your period, and you're wearing, of course, it has to happen. And we've all been there, white pants,
Yes.
right?
Yeah.
Right. And then the embarrassment of that. So tracking is a really good idea, not only for that, but also for health reasons. Because if things are irregular, she had a period and then she hadn't had one in 4 months, it's kind of weird, right? Like, what's going on? So there's apps on the phone. There's so many ways to track, but just circle, like circle it on a calendar. They have school calendars, just circle it, put a P beside it, just simple things. So tracking periods is really important. Second, if your child, boy or girl in the sense, your teenager is now saying, okay, I'm thinking of being sexually active, the HPV vaccine is typically 3 doses, and it is sometimes provided through schools, depending on the state. But it can help with decreasing the virus that causes cervical cancer and different cancers in boys as well. So that's one of the reasons why we like to start the vaccine before they become sexually active, so that they don't get those warts that can cause those cancers later on. Is it something that I would recommend? Again, risk versus benefit, we've seen more benefit from getting the vaccine versus risk. So it is something that even with my children that I did vaccinate, I vaccinated myself. So even though I was older, I still vaccinated myself because I did have stage 1 cervical cancer, and my oncologist recommended that I get the vaccine, even though I already was past all of this, right? And I did. And so I've been really well in that sense since then. And I think it also is, I know it's a comfort to know, okay, I've got something on board as well to help. So it is really important to look at that and have that discussion with your pharmacist or your physician, read more about it, see what the side effects are, just understanding about, the different cancers that can come from that. And the gratitude that we have that someone did the right research to actually help prevent some of this. So
Mhm,
it's not
mhm.
childproof. It's not 100%. No vaccine is. But this particular one for your teenagers to protect them later in life, because that's when it can come out, is actually a really good vaccine. And there's no signs or symptoms. It's not like you'll always get, especially with girls, you're not going to get a sign of it until sometimes it's too late. And then, you know, you find out that there could be an issue with cervical cancer. So it is something that I think is helpful and should be done before any like pregnancy years, like thinking of conceiving. You should probably look at getting some of your vaccinations well before that. Or getting birth control pills. Again, it's obviously to prevent pregnancy for girls. There are different ones on the market. What we see is estrogen and progesterone ones. There's ones where they have to take pills. There are injections. There's IUDs. There's many different things. IUDs typically will be for older girls. You're talking about 18, 19, 20-year-old girls. You're looking at that. There are some risk factors with ovarian cysts with those. Birth control pills, we know long term and smoking is not permitted in the sense that it increases your risk of stroke. Birth control can increase the risk of stroke because of the progesterone and estrogen combinations. But again, risk versus benefit. If you do low dose and you try and prevent pregnancy, that obviously is I wouldn't say a bigger risk, but a bigger issue for your child who doesn't want to have a child at that point, right? So it is a preventative measure. The other thing is sometimes we see birth control pills used for acne. And when you layer them in compared to using things like tretinoin or the other harsher ones, sometimes those are the first step and they work really well,
Mm.
of antibiotics. So sometimes that's the reason why they're put onto those. So again, it's asking the questions, doing your research. I like Medline Plus, drugs.com, and the Mayo Clinic. Those are my credible resources.
Okay.
I refer to those. I think they give good information. Medline Plus is from the US National Library of Congress, so it's really got a lot of good health information. And that's kind of where I do my own research as well and just look at things. And I mean, I have access to a whole bunch of different studies, but in general, that's a really good quick resource guide to check into the side effects of medications and why you want to put your child on a medication. You need to ask, is it a benefit?
This has been so insightful. Okay, last question is about safety for teenagers. So we all think, we're like living in this safe, home environment where, you can describe the scenarios because you said you've seen this happen a lot. So tell us about the risk of leaving medicines in your house that it's not in a safe environment.
Right. So, when we talk about little kids, we say up high and away, right? So we don't want our children to access medication when they're toddlers or, at any age when they're younger. When they're teenagers, it doesn't mean your medicine cabinet should be left unlocked or available either, because it can happen, and it has happened where, I had a situation where one of the moms had a medication because she broke her wrist, and it was a opioid medication. The son had fallen and hurt himself and was in pain, and she's like, "Well, I have this painkiller. I can give you this." Unfortunately, teenage brain, when you're looking between 13 and 25, these medications don't have the same side effect profile necessarily as adults. And we don't test medications on teenagers, right? We don't do clinical studies on teenagers, pregnant women. We don't do that as often as we should necessarily. So when you're looking at these really strong opioid medications, don't give them to your child unless you have a plan with it. It's only for 2 days, or it's at the lower dose, because just because it worked for you doesn't mean it's going to work for your child. Lock those up. There are a lot of medications that, are accessible to them. You don't know what's happening at school. You don't know if there's a TikTok trend on something. Lock up your medications. It's really important to do that. And you have the code. Don't share it. And really be careful. And I'm not suggesting that every teenager is going to go in there and raid your medicine cabinet. But what I am saying is, if you're not home and they're like, "I have a bad headache. Oh, mom has this in the cupboard. Maybe I try that." That's an accident that doesn't have any real major, I'm trying to be malicious or bad about this, but it has a consequence that could end up them going to emerge. So
Yeah.
it's really important, especially if they're on other medication. That drug interaction could cause them to really have a problem. We know mixing sleeping medication and antidepressant medication with some opioids or painkillers causes people to stop breathing. So lock it up and then really be careful when you are giving medications to your children, especially if they're yours. I wouldn't recommend it. Sharing is not caring in this instance.
That's great. That's such great advice. Okay. Anything that I didn't cover that you think is really important for the moms to know?
I just think that they need to understand that no matter what happens, the guilt level of moms needs to take a step back.
Yeah.
Constantly, putting it all on our shoulders. I think what's really important is doing the best that you can and being the best caregiver that you can in your situation, and giving yourself that grace.
Totally. That's wonderful and perfect way to wrap up our episode. And so how can people find you going forward?
Well, I just started my Instagram account, so it's at Lidia Molinara, and so I'll be posting a lot more helpful hit tips on that as well.
Okay. Well, thank you so much for your time. We really appreciate it. This was actually amazing. I'm so blown away with everything that I feel like I learned. So I'm sure all the moms out there got something too. So thank you for your time.
Thank you so much.
Thank you for listening to the Positively Healthy Mom podcast, because there's no manual for the hardest job in the world. Don't forget to subscribe and share with your friends.